Across Africa, millions silently endure the pain of chronic wounds, like diabetic ulcers, sickle cell leg ulcer, and traumatic injuries. These wounds don't just hurt. They lead to infections, amputations, long hospital stays, and lost livelihoods. Behind every case is a patient, waiting for affordable, effective care. Lucilia sericata Maggot therapy is a natural and proven method that heals wounds faster and at lower cost. But in Nigeria and much of Africa, adoption is still limited. Why? Unreliable supply chains, lack of digital monitoring, and no structured data to guide decisions. Introducing LuciTrack, a digital platform for maggot therapy management. LuciTrack empowers hospitals, clinics, and field health workers to schedule and track therapy, monitor patient progress in real time, manage sterile larvae supplies, integrate IoT sensors and medical records. It transforms a biological therapy into a smart, scalable digital health solution. With LuciTrack, patients heal faster, clinicians work smarter, and governments gain reliable data for stronger health policies. It reduces amputations, lowers costs, and brings accessible wound care to those who need it most. Starting in Nigeria, scalable across Africa, and adaptable worldwide. LuciTrack, digital maggot therapy management. Smarter healing for Africa and scalable for the world. Join us in transforming wound care. Powered by National Board for Technology Incubation, NBTI. Product of Green Tech Visionary Enterprise Limited, located at Bauchi, Bauchi State, Nigeria.